Hi, I'm Dr. David Smith, sleep researcher, assistant professor, and board-certified sleep medicine specialist treating sleep and circadian conditions. In general, it's best to take the lowest effective amount of melatonin. Studies suggest that 1 to 2 milligrams about 30 minutes before bedtime is an optimal level of melatonin to help adults fall asleep naturally without next-day grogginess. For children, though, as little as 0.5 to 1 milligram taken 30 minutes before bed may help. If you take too much melatonin, it can actually make you feel groggy, and sometimes it can disrupt your sleep-wake cycle. So you want to try to take the lowest amount possible for the best effect. It has a quick effect. It works very quickly, and that's why we typically say take it about 30 minutes before bedtime, because that's going to give you the best effect for both falling asleep and potentially having a restful night. I'd be cautious about any supplements that advertise extra strength because too much melatonin can actually disrupt your sleep. It can make you have less restful sleep, and it can actually make you feel groggy the next morning. Higher amounts don't necessarily mean that your sleep is going to be better. You can't really overdose on melatonin. We do think that if you take high doses of melatonin for a long period of time, it can actually change receptor levels, but you can't necessarily overdose on melatonin. Even at high doses, you don't absorb a lot of melatonin. There's a certain amount that your body uses. The rest of it just sort of goes to the waste. And so that's why it's really important to take the right amount of dose, because even at low doses, it can be very effective. So taking melatonin every night is actually safe and effective. Some people may need to take melatonin a few nights before they feel the benefit, and melatonin is not habit forming. So it's fine to take it one night and then not take it the next and still have the effects that it would typically give you for better sleep. If you're having trouble falling asleep for more than 2 weeks, then I would definitely say it's worth talking to a physician about it, because these typically suggest that there are problems that are potentially going to be harder to treat, and melatonin might not necessarily help with that. But you can start and stop melatonin without any problems. It's not a medication that we recommend you have to taper up or taper down on. So it's fine to use it as you need it as well. It can interact with other medications that use the same enzymes in the liver to be metabolized. So we do recommend that if you're taking other medications, that you talk to your doctor about the melatonin dose that you're on. We don't have a lot of good studies that tell us what the effects are for melatonin on your body when you're pregnant. And so we definitely recommend talking to your primary care physician or sleep medicine provider about the use of melatonin while you're pregnant.